Vijay Anand Vujala was hopeful after his hip replacement surgery.
Doctor, when will I be able to play volleyball again? After a few months of rehab and physio, you will be as good as new.
But as months passed, the pain refused to go away.
You promised that after your surgery you will play with me.
I know, but what to do? It still pains a lot.
Many such people who had hip implants by Johnson&Johnson had the same problem.
Looks like we may have to do another surgery, a revision surgery on you.
Soon the government announced,
Due to Johnson&Johnson faulty implants, every patient will be given a compensation of 20 lakh rupees.
Johnson&Johnson is a 130-year-old healthcare company headquartered in America, better known in India since 1947 as the maker of baby products. They are also a huge medical devices firm, and they started selling their ASR hip implants in India from 2006 after obtaining permission from the DCGI. According to what they said, it was
Long-lasting, durable, and has a lifespan of 20 to 25 years compared to current ones which last for just 10 to 15 years.
Hip implants are made in three basic materials: metal, ceramic and plastic, and used in various permutations and combinations. For example, the cap could be made of plastic, while the ball could be made with ceramic and the socket could have a metal lining. Johnson&Johnson's implants were metal on metal, containing cobalt, chromium and molybdenum. The hip joint could be entirely replaced or just the socket resurfaced. It appears that in some patients, their implants may have released bits of those metal particles into the bloodstream, while in some, they were failing for other reasons, causing pain and discomfort. A little after they were approved in India, in 2007, Australia found
their hip implants had a higher than average replacement rate,
and a year later were asked to withdraw their implants from the market. By 2008, the US FDA received about 400 complaints stating failure of the implant and the requirement of revision surgeries. Within the next 2 years, more than 10,000 lawsuits were filed against DePay Orthopedics, Johnson&Johnson's medical subsidiary in the United States. Faced with millions of dollars in potential damages, Johnson&Johnson recalled their hip implants.
Do not implant further ASR devices. Patients who implanted them must be instructed to see their doctors.
Is it possible that Indian surgeons were unaware about the global recall and still use the product as if nothing had happened? Doctor, which implant are you using?
Johnson&Johnson is the best right now.
The Maharashtra FDA was the first Indian agency to file an FIR against DePay in 2011.
If the product was recalled all over the world, how did the licensing authorities permit it in India?
Unfortunately, this is not uncommon. Despite DDT being banned all over the world, along with North Korea, India is the only other country where it is widely used in agriculture and to repel mosquitoes. With 93,000 devices already implanted, in November 2013, they agreed to one of the highest ever payouts in the medical industry. $2.5 billion to 8,000 patients in the United States. Meanwhile, the Central Drug Organization sought details of recall, procedure, reason and compensation given to US patients, after which in 2013, they finally
We are recalling their products in India as well.
Recalling a medical device is not like recalling a consumer product like some of these famous ones. Nestle's Maggi, Samsung Galaxy Note 7, see BISBO's story on why they were catching fire. Volkswagen diesel scandal, see BISBO's video on how they falsified emission readings. It takes several years before doctors know whether a device is failing or performing, which is why a mechanism to track patients is needed, like a national joint replacement registry. A similar episode in the 1950s woke up the US. Thalidomide, a sleeping pill, was sold to pregnant women as a cure for morning sickness.
But the drug interfered with the baby's normal development, causing many of them to be born with shortened, absent, or flipper-like limbs.
Thalidomide was one principal reason US drug laws are so strict. Under the present legal provisions in India, Johnson&Johnson cannot be compelled to pay any compensation. While each patient in the US received 1.87 crore or 187 lakhs, the Indian government has unilaterally announced it as 20 lakhs for its 4,500 patients who received Johnson & Johnson's hip implants. Compare this compensation to a case of death in a car accident, where the payout is a meager 5 lakhs as per the Motor Vehicles Act. India really needs to value its citizens better. The government will identify those eligible for compensation. And though Johnson & Johnson is cooperating with the authorities, they believe
We will not pay for patients with an ASR implant who are doing well.
they have placed ads in the newspapers and got a helpline going. But so far, only 1,082 of the 4,500 have contacted them. Patients will get an idea of how difficult the process will be because the website of drug regulator SEDESCO, where they are supposed to fill an online form, is down, while their form is untraceable at another of their sites. Still, getting compensated is a long process, where those already suffering will have to undergo even more tests before they see any money. Do pass this video along so that others who don't know about the recall can also be compensated. BISBO's Limerick! Johnson & Johnson has been selling faulty hip implants. Now those that are suffering finally get their chance. Will 20 lakhs cover? Will they fully recover? It's a long road to compensation, but just maybe they will